Hello, this is Dr. Gurung. I'm a senior psychiatry trainee. One of my interests is teaching. This is the second YouTube video which I have made. For the second YouTube video, reflecting on the first YouTube video which I made, I've learned that there are certain things that I need to improve. One of the things that I've learned from my first video to the second one is I bought a New Year gift to myself. This is a microphone. Hope with the microphone I will have more clarity in my video. Okay, Happy New Year to everyone. Today I'm going to present a very interesting topic: audit. One of the things that I have noticed is, people who haven't worked in NHS before, who are a junior doctor, they really don't know what is an audit. And I've been working in psychiatry for almost 7 years. I did my co-trainee, and after co-trainee I took almost 3 years gap, just to work as a middle grade associate specialist, and finally decided to come back to an SC trainee. During my co-trainee days, I was extensively involved in doing audit. People who are in psychiatry trainee, they are expected to do one audit per year. Okay, so without spending much time, I have prepared a slide for an audit. People who want to know more about an audit, they can comment below to suggest any of the topics, especially in critical appraisal or in workplace. If the doctor wants to know anything, I'm more than happy to make further videos. Okay, Happy New Year to everyone. So let me start my slides. Okay, so let us go from the beginning. You can see me on the left side, left corner of the slide. I'm a person who loves to tell stories, and when I present the slide, I've got a total of 22 slides. So when I explain this, let me take you to the journey. What is an audit? Okay, so an audit, by simple definition, is a systemic examination of a current practice to assess how well an institute or a practitioner is performing against the set standard. Let me make this in a very simple term. Like when you work as a junior doctor as well as a senior doctor, one of the things that we have to make sure that we as a trust or as a clinician, we are performing our role or a duty as per the set standards. Especially in UK, the set standards are set by NICE guidelines. There is also a GMC guidelines. So there are different kinds of guidelines, the national guidelines. On top of that, the trusts also have the set standards or the guidelines which they are expected to work. Every trust, they are reviewed by CQC, which is a clinician commission group that comes and sees whether we are performing our duty as per the set standards. So for that reason also, audit is very important. Audit, it tends to fall in the lower bottom of clinical evidence-based practice. I will be presenting on different types of study design in coming videos. So in this video, this will be very short, 15 to 20 minutes. Hope I don't cross 15 to 20 minutes. Okay, essentially it's a method of systemic reflecting, reviewing, and improving the practice. Okay, so let us go to the second slide. When we do an audit, we also have to make sure that there are certain steps that we have to follow. Okay, in the coming slides, I have made things simplified, and I'm also going to give you some examples of my audit, so it becomes easier, people who want to do an audit. So in an audit, the first and foremost thing is we have to choose a topic, in which we want to do. Especially like junior doctors who haven't done audit before, what they can do is, every trust, they have got an audit lead, audit office. So if anyone is interested in doing an audit, they can discuss with the clinical or educational supervisor or consultant about them and decide what topic they might be interested. Once they start to work in 1 or 2 weeks, they might notice some of the practice as a team, or as a clinician you might not feel are done up to the standard. So those topics can also become an interesting topic for an audit. So the first and foremost is you have to choose the topics and what you want to achieve from doing an audit. Second is the standard guidelines that you have to set a benchmark, design an audit, execute an audit, analyze it. So till 5 it's the preparation of an audit. 6 is analyzing it. Then once you finish an audit, you can present in local teaching, as well as in UK there are a lot of conferences. If you feel like your audit is up to the standard of present in conference, you can present it. After you present an audit, there might be certain recommendation that you want to put forward just to make sure that there's an improvement. And the audit cycle is completed once you make a recommendation, and you have to give a time frame of, let us say, like 6 months, 12 months to do an audit, just to make sure the recommendation that you have made in the trust have made the changes or not. This is an audit cycle. When I'm trying to explain all of this, it might just go off your head. So to make things easier, I have further slides, so hope people will know what is an audit. Okay, so when you do an audit, the first and foremost is you have to put your name. Okay, without a name, people might be confused who have completed an audit. Date of the presentation of an audit. So this is like a standard template how to present your audit. Okay, so you have to give a background to an audit. In the background, the things that you can consider is why you have chose the topic in the first place. For example, high risk, high volume, high cost, patient safety, incidents, complaint, mandatory, like commissioner led, who acted as an audit lead. Okay, so when you register your audit in an audit team, okay, so there's in a form, they might also expect that who is leading an audit. For an audit, sometimes what happens is it becomes if the audit, the topic that you are taking is a very big audit, you might need some people to help you. For example, in data collection, data analysis, data supervision. So the rules have to be very specified in when you send for an audit approval. Okay. Did the audit have to gain approval? Most of the time, yeah. If you are working in a trust, you have to get approval from the clinical audit registration process and community approval. Okay, so this falls in the planning for the audit. Aim of an audit. Okay, when you do an audit, it's not like you just do an audit for the sake of your portfolio or for the sake of just doing an audit. The aim needs to be specified. What you want to achieve from an audit, it needs to be very specified. When you put an aim, it's always good to put in a bullet points, so it becomes clear that what you want to achieve. For example, this is one of the examples: improve the quality of clinical record keeping within an organization. Now in most of the trusts that I've worked in different trusts in this 7 years in psychiatry, 1 year in medicine, especially in UK. So I've been working in NHS for the last let us say 8 years. So like a lot of the trusts, they used to have a paper kind of clinical records, and I think because of lot of the complaints and this and that, or in different trusts they must have done a big audit. And from the audit, they must have identified, okay, to improve the quality of clinical records, most of the trusts now have got electronic record keeping. Okay, useful verbs to use in writing an audit are to improve, to enhance, to ensure, to change. It looks nice if you want to put some positive kind of wrapping in a name. So before I move to the next one, when you present an audit, this is just a summary. First is you have to give, for example, who is doing an audit, on what date you want to present, the background, the reason why you want to do an audit, what you want to achieve. So we have done 3 things. Okay, the first one is name, background, and aim. Okay, objective. Most of the time, when people are doing audit for the first time, they might get confused with aim and objective. Okay, aim most of the time might be just in 1 or 2 sentence. Aim is what you want to achieve, but objective as a whole is broad overarching statement. Okay, objective add clarity to the aim. For example, objective of clinical audit might be to access the clinical record to see if they meet the best standard, identify the example of good record keeping to cascade, identify the example of poor record keeping to highlight the problems and aid in training the staff. So objective is basically what from the aim we try to specify, be more specific. Okay, identify the best practice. Now this part is comparing with the standard. Okay, so when you try to find the best practice, for example, like the example of a clinical record, is we try to search for evidence of literature, like professional, such as asking patient, other stakeholders. Okay, most of the time, if you're working as a doctor, I would look for in NICE guidelines, general medical record keeping standards, Royal College of Physician, nursery midwife, and when you choose a standard, okay, you need to be very specific that okay, this is the standard that I'm comparing it. Once you choose that, okay, you have to specify what are the criteria and the standards. Inform the audit specifically what aspect of the care are being measured. Criteria and standard highlights the best practice. Include exception. Justify records which may result in a care not meeting as agreed. List the criteria and standards in the table. Okay, so basically, this is just the explanation of what are the things that we need in the standard guidelines. Okay, now coming to the population and the sample. Population and sample means basically when you collect data, and data is you have to describe the population of the audit you are identifying, like all the patient recorded in hospital. When you try to specify the population, you have to specify from where you are taking the population. Like if you want to compare the clinical record in a hospital, okay, you have to specify. For example, I'm taking a population from a hospital in this particular hospital, okay, from this record. Detail of sampling technique that has, okay, and this is more complex, like confidence number, random, simple, this and that. But in simple audit like this, I would just, for example, if you look at the clinical records, there might be 100, 200 clinical records. For a normal standard audit, 25 sample is the minimum requirement, which is good. The more the sample you have, the greater the power of a audit. Hope I made sense. Okay. When you collect the data, okay, the other thing is you have to make sure that whether the data are electronically collected, okay. Demographic, the population, the clinical, okay, daytime. There are a lot of things that is given in the slide. Okay, just to make things easier, let me just specify. Okay, when you say data collection, let us take an example of electronic record in a hospital. Okay, you also have to specify from what time to what time. Let us say 6 months, 8 months. Then it becomes very specific in what data you are collecting. Who collected the clinical data? As I've explained before in the first slides, you have to allocate the role. For example, if you are doing an audit on your own, you can write, you have designed an audit, you have collected the data, you have analyzed the data, and you are presenting. Okay, It make if you do that, it shows that you know the whole process of an audit. But sometimes, if you are busy in a clinic work or this and that, just collecting a data also gives you a certificate. Okay, so when you are doing a data collection, you can use spreadsheet like MS Excel, computer short or this, just to make sure that you have actually collected the data. Okay, data analysis. Data analysis can be done by a number of ways. For example, when you collect the data for like 6 months and you have got like 40 or 50 people of sample, it's called sample, then just to make sure that you have, it can be analyzed by Microsoft Excel, SurveyMonkey. There are different tools. Okay, when the data was collected, years, how long. Okay, so this, which I've already explained. Analysis also, it takes a bit of time. Okay, for data analysis, okay, the same example let us take. For example, we have taken a data of 40 people, which is random. Random means just pick it up, and randomness provides more power. That means that if you just select the people, and if you know what population that you are getting, or if you are choosing the nodes that is not recorded properly, sometimes what it causes bias. Bias means that the data that you have collected doesn't reflect the true kind of audit. Okay, and it can be connected retrospectively. For example, if you are going backwards, we are in December. If you are collecting a data from, let us say, from November to 6 months before that, it's called retrospective. But if you have decided to collect, let us say, in the coming three months, it's not retrospective. We are going front. Okay, which is called process. I'm not sure about the term, but I hope people understand what I meant to say. Okay, audit result. When you present an audit result, it can be done by a number of ways. I would prefer to give in a pie chart graphic. It can be easily done if the data is collected in the Microsoft Excel. There are some tools which, when you highlight it, it can show it, and when you present, it also look nice in graph and pictures. So people, sometimes when you present number of just the number, people might not be able to correlate. The picture speaks 1,000 words. Okay, make sure patients and individual clinicians confidentiality is maintained. It's not good to disclose the name and the clinician who have made a mistake. Confidentiality is a big issue. Okay, so just be aware of that. Observation rules outlines. Okay, so once you collect the data, when you analyze it and present it, what you tend to do is you try to compare. Okay, this is the standard guidelines and this is the data which you have collected. So you have to make sure that whether it's proportionate to the standard guidelines or not. From there, there are a number of things that you can identify, like identify area for improvement where cases in less than agree the best practice. When you collect the data, there might be some limitation. For example, records could not be accessed because of, let us say, confidentiality, or there might be a restriction. Okay, so limitation also needs to be specified when you're doing an audit. As I said before, all the observations need to be backed by factual evidence. So when you collect an evidence, also make sure that don't say that I've just collected it, but also make sure that you have got the audit tool to show to any people who wants to want to counter check your audit. Okay, the discussion parts mainly happens when you present an audit. Once you finish an audit, it's always good to present an audit because it gives an opportunity, especially for your audience as well as the people who are present on audit, to express their views, and from there a number of recommendations can be made. This is saying that it's always good to think If you have got one head, you can only think, you might only have like one or two views. But if you discuss in an audit, you might have multiple views that we might not have thought about it. So those all of the things that can be written in a recommendation just to make sure that the changes are made. Okay, so this is an example of recommendation and action. Okay, specified areas of improvement, what action to be implemented. Okay, so from the audit that the simple audit of data record keeping. Okay, so the example might be area of improvement. Blank ink not used regularly in the clinical notes. NHS supply only the black ink. Who will take the lead? Office manager. So you have to specify that, if you are making improvement, who is going to keep an eye, and also specify at what time you expect these changes to be made. If there's a thing that it's also applicable in any walk of life, that if you specify everything in a detail, for example, like tomorrow if I want to exercise, I might say, okay, I'm exercising at 8. To do that, I might need a dress, a shoes. So the planning needs to be time, task specific. There's a rule in analysis which is called as SMART: specific, measurable, achievable, time specific, and memorable. Those are the things needs to be there. I think this audit was relevant, let us say, like 10 or 15 years ago, but now most of the trusts, they use the electronic system. Okay, so the next step, report writing, and you distribute your report to within the trust, the people who can make changes. Okay, and you also have to give at what time you expect to repeat the audit to make sure that recommendation that you have made has been implemented. Okay, so the last slides will be, you have to it's always good to end your presentation with acknowledgement, like the people who help you to conduct an audit, for example, research, librarian, IT department, nurses, clinical audit, local hospital, trusts. Okay, and reference. In reference, it's always good to put the standard guidelines, okay, and any relevant literatures that you have searched, especially in the background. Thank you very much, and I hope you love my presentation on an audit, and people who are planning to do an audit might be able to at least try to do it. Before I end my presentation, we just have to be mindful that in the past, audit used to be a thing, but now there's something called quality improvement. Quality improvement is like a constant kind of making an improvement. So it is regarded, quality improvement is much better than an audit. Okay, thank you very much. I finished my slides. I'm trying to click. Okay. So I'm done with the presentation. I hope I didn't bore people with a lot of stuff. Okay, thank you very much, and I finished telling my story. Have a good day. Bye.